New Hanover Regional Medical Center. We're going to go and tour through our Women and Children's Hospital first.
Okay, thank you.
Thank you very much.
Please don't worry, just step at the desk there, okay? Thank you.
So this is the atrium inside Women and Children's. We have a really nice grand piano here that a lot of times people will come and play during the Christmas holidays. Sometimes we'll also do events in this area as well. Last year they had Fleet Feet, one of the shoe stores in the area, come and bring a lot of different athletic shoes so you can try them on and maybe buy some. This is the Lighthouse Cafe. This is one of the places that we can eat in the hospital. We get a $1,200 budget each year towards food. Usually we don't spend it. Typically, entering here, you might spend more. The really nice things about the Lighthouse Cafe is that you are able to come and eat outside, which is great. Most people here in Wilmington. All right, now we're going to head up to labor and delivery. All right, this is our triage area with a lovely triage. This is where patients will come whenever they're over 20 weeks and need some sort of medical assistance, whether they stub their toe, which we've had before, they have a sinus infection, they think they're having contractions, or they're actually in labor. So now we're going to go one floor up to the pediatric unit. So just came upstairs from our labor and delivery unit. That's where you'll spend 2 months during your intern year, 1 month in each half of the year. And now we're coming up to our pediatric unit. It's about the same schedule. You do 2 months in the first year, 1 month in each half of the year. So the pediatric playroom is closed right now because of COVID, but we can see it through the fish tank over here. So this is the garden on the pediatric floor. I know I like to come up here sometimes when I just want a nice quiet moment to spend outside. But it's also really nice for the families as well to get a little bit of outside time without having to leave the floor. This is one of our typical pediatric rooms, which is really nice for families. They have roll-out beds that the families can all sleep here with their kids. And very nice for the kids. There are PlayStations in every room that access movies as well as video games, so they have a lot that they can do while they're here. Head up to the third floor to see the mom, baby, and nursery. All right, now we're on the mom baby unit and the newborn nursery floor. This is the third floor of the Women and Children's Hospital. So we're just going to do a quick little walkthrough. We're going to go take a quick look in the newborn nursery, which is right behind these windows. So as family medicine, we do circumcisions for all of the babies we take care of here in the hospital. This is the room where we do circumcisions with the nurses. All right, now we're gonna head back downstairs and over to the ED. So all along this front hallway in the hospital, there are a lot of different plaques just talking about the history of the hospital and the history of medicine in general. We also have the outpatient pharmacy here at the hospital. It's a really great service for our patients whenever both they are getting discharged so they don't have to go anywhere else for medicines, but also patients who come to our clinic are able to get their medicines typically at a discounted rate here. Right down this way to the emergency room. All right, now we're going to do a quick walkthrough of the ED. Our ED has about 100 permanent beds and then about another 80 temporary beds if needed. right this way. The medical ICU is an open ICU. We take care of all of our inpatients in there except if they are on a ventilator or they have anything else that needs to be managed by the intensivist. So from the ED, we're now going to head over to Oban-Pan, which is the second of our 3 options here in the hospital. So we come to Oban-Pan quite a bit, especially at nights, because they're the only place in the hospital open late until about 2 in the morning. All right, from here we're going to head down to the cafeteria. All right, now we're going to walk through our cafeteria, which is open for breakfast, lunch, and dinner each day. The great thing about the cafeteria is it's really close to our call room. The cafeteria also has a really nice outdoor area where we can just sit and have a break. All right, this is our family medicine workroom in the hospital. Whenever we're on our inpatient service, this is where we work on notes, talk to patients, talk to the families, and talk to anybody else we're doing consults with or need help from. So this is something we do on our BMed days, which is Thursday morning on inpatient service. We use this acronym SCREAM, in which we ask each of our residents on inpatient service to go through and pick a patient and ask all these questions to them to get to know them better socially and to get a better social history so we know what we need to do differently to help them out better. Other things that we do while we're on the inpatient service, each day someone is assigned to do teaching. So Monday mornings is traditionally EKG. Tuesday is, pharmacy teaching. Sorry, Justin. Wednesday, the attending teaches. Thursday is behavioral rounds. And then Friday morning, it'll be one of the residents doing a teaching topic of some sort. All right, we're going to take the elevator up to the South Tower now. All right, now we're going to go see what one of the typical adult medical inpatient rooms looks like. All the rooms are pretty similar. Everybody gets a really nice window. There's a fold-out bed for family as well as a nice chair. Everybody has their own room, which is really great whenever patients are recovering, because I know I would not want to share a room with anybody if I was feeling sick. This room has a pretty good view. You can see the Cape Fear Bridge in the background going over the Cape Fear River. So this is our resident workroom. This is where all the different residencies in the hospital can come and work together. There are also really nice free snacks and free sodas if you get thirsty, and lockers to store our stuff in whenever we're on different rotations. Alright, that's the end of our tour. Thank you guys so much for watching this tour of our clinic in the hospital. Please let us know if you have any questions.